Good afternoon, ladies and gentlemen. I'm by the name of Safina from Nodal School of Nursing and Midwifery. Today we are going to look at gastric lavage, and before us is a patient by the name of Mr. Mulago. So you have to introduce the procedure to Mr. Mulago so that he's aware of what is to happen to him before starting on. Good afternoon, Mr. Mulago. I'm by the name of Safina from Nodal School of Nursing and Midwifery. I would love to pass a tube through your nose so that you can remove the agents which you had inhaled. Am I allowed? Thank you so much. So we have to screen the bed for privacy. Wash our hands and then protect ourselves with an apron. So before I start on with the procedure, I have to make sure I present the trolley and you understand what is composed of our trolley. So on our trolley, it is a clean procedure, meaning we need clean gloves or disposable gloves. We have a tray containing 3 galley pots, one for warm water, one for cotton swabs, and the other one for the gold swabs, which will be used for cleaning the nostril. We shall need a vomitus bowel. Being an irritating procedure, a patient may feel like vomiting, so we have to offer a vomitus bowel. We need a receiver containing our litmus paper. This is to help us test the pH of the stomach content. We shall need KY jelly to lubricate the tube to ease passage. We shall need a clip to prevent air entry as we're inserting in the tube. We need a jar of cold water. This is to help us rinse the stomach content. A 15 ml syringe will help us to aspirate the content. We shall need a receiver containing an NG tube for insertion, and it should be of a good size for the patient. We shall need a stethoscope. This is also to help us confirm if we're in the right C2, which is the stomach. We shall need a funnel to help us aid as we're pouring in water into the stomach. We shall need this tube still to connect on the NG tube to allow flow of water. And then we shall need strapping to secure the NG tube in situ. So on our bottom shelf, we shall need a Macintosh and a towel to protect the patient's clothing. We shall need 2 different receivers, one for receiving the used funnel and the other one for receiving the used gloves. We shall need another box of disposable gloves just in case these ones are soiled. Then at the bedside, we shall need a hand washing facility, a suction machine just in case our patient is unconscious. We shall need a screen for privacy. Thank you so much. So I make sure my trolley is near the patient's bedside. Mr. Mulago, allow me to position you. So the patient will be positioned in a sitting up position, and this is our nurse's procedure. Mr. Mulago will adapt a sitting up position. So I have to make sure I protect my patient's clothing using a Macintosh and a towel. Inspect the patient's nostrils to confirm there is no blockage or secretions. And then choose which one to use. Mr. Mulago, don't worry. I have to make sure I clean the nostril, which I'm interested in for the procedure. Get my NG tube, take measurements. You're going to measure from the tip of the nose, behind the ear rope, the sulfide process, and then label where it has ended, so that we are sure we are inserting in the tube in the right position. So after that, we are going to apply KY gel to the tube and then insert it to prevent irritation. Mr. Mulago, don't worry. So after inserting in the tube, make sure The patient swallows in between breath. Mr. Mlago, it's kind of irritating. Please swallow. Swallow. So you have to insert the tube until the point you had measured. After that, you have to secure the tube. Remember, you have to prevent air from entering this tube. So you're going to spigot populate the tube to prevent air entry, and then secure the tube using our strapping. After that, we have to confirm if our tube is situ. And you said we have 3 ways of confirming. We can use our warm water. The moment you slip up was in the water, then we are in the air. We mean we're not in the right place, so there are no air bubbles. We can use the litmus paper after aspirating. So you get your 6 ml syringe, kink the tube, and then aspirate. You'll be able to see stomach content running in the tube. Then get a sample. And test on a litmus paper. So our litmus paper has turned red. The other way we can test if we're in situ is by using a stethoscope. Make sure your stethoscope is under patient's stomach. You're going to push in air once, and the moment you hear a bowel sound, then you know you're in the stomach. Thank you. You're in the stomach. So after that, we are now going to connect our funnel to perform our lavage. As you're connecting the funnel, make sure one side of the tube is connected to the funnel to aid easy flow of water, and then the other tube is connected on the NG tube. After that, you're going to clip near the funnel. Then remember, we had our jar of water. Take the measurement, confirm how many mils of water they are, because we have to measure the amount of water removed out after doing the procedure. So remember, we had aspirated our content to know the color, which exact color is the content, for us to be sure as we're removing this water, it should be clear. That will be a good confirmation that our content is done. So you get your amount of water. I'm going to put there 300 mils of water. You pour in and release to allow flow of that water by gravity. So the water levels are going to increase in the stomach. After that, we have our buckets, which is going to receive the water. So you're going to invert the tube and invert the funnel to allow flow of water by gravitation force. After that, immediately we are going to disconnect the tube, put it in one of the receivers, and then we have to clear away, remove the tube from the patient. Mr. Malago, I'm going to remove the tube. Since the indication for inserting the energy tube has been achieved. Sorry, don't worry. Be gentle as much as you can to prevent irritating the patient. After that, you clean the patient's nostril and put it on on the bottom shelf. After that, you have to clear away everything you use on the patient and make sure you use the patient very comfortable. Sorry. Don't worry, we are done with the procedure. Hope you're comfortable now. So we have key points to note when we're doing a lavage. First of all, you have to make sure you insert your NG tube into the patient's, through the patient's nostrils to the stomach, and make sure you always confirm that you're in the right slit tube. Before lavaging, make sure you aspirate the content to confirm if they are stomach content. Then the other thing, you should always connect a funnel onto your tube to make sure water flows easily by gravitation, and then later you invert the tube and let water flow out still by gravitation. Always note the color of the stomach content before introducing in water, and then note the color of the stomach content after doing the procedure. Thank you so much for being cooperative. This is the end of the procedure.